first thing that came to my mind is like, oh no, it's SARS again when, we have this disease outbreak. All the feelings from 17 years ago start coming back.
I have some working experience with SARS. I know what SARS was like. But very soon as the number goes up and you see how the things start spreading in communities, and there's a different kind of pattern.
In March 2020, when WHO declared it as a pandemic, and it became also real. I remember it was during the Chinese New Year holiday that we are asked to decant our clinic G. It was very immediate. Over the long weekends, we have to act fast.
From strict adherence to the safe distancing measures, temperature monitoring, then we also have enhanced disinfection processes of our workplace stations, and as well as our medicines.
Our department has segregated the labour ward into two. One is a normal case, one is with the isolation area. The isolation team, they look after all pregnant women with acute respiratory infection.
We also touch base with our colleagues who are either on stay-home notice, quarantine order, and so on. We also check in with them to make sure they have the required support, they have the resources, and in addition, we also ask them if they are doing okay.
The fear is there. We don't know who is suspected cases, who are confirmed cases. So it can be quite challenging. It's very challenging actually.
Of course, yeah, because we are carrying, the virus materials, so we have to be careful about that.
MOH has actually come down to ask all the public hospitals for help. Approximately 400 samples a day. Actually, 400 samples a day is our official maximum capacity. That's not counting our in-house patients, as well as those that come from the dormitories that we are serving.
So I remember on Monday night, I got the message from our point of contact saying that I have to lead the clinic. I have to lead one of the team to go to a dormitory. For the following 2 weeks, while I did my volunteer duty, situation does change every single day. Being in the front line, you know that things may happen, and if things happen, you and your team will be the first person to have to tackle the change.
Other than myself, my whole family is at home, so I don't really get to see much of them, and then when I get back, I'm quite tired already, and even weekends, I have to be rostered in to cover the weekends as well. I think for my team, they also feel the same thing.
When you come home, you're very exhausted, but as a mom, I still have to play my role with my children and try to explain to them actually why mommy is extra tired today.
Any change will be always hard at first, but I am proud of our department because I see the nimbleness and the good adaptive attitude that we had.
We are all part of the healthcare system. So I believe that, we can play a part in actively supporting, and work hand in hand with the nation to overcome this crisis.
Going through a difficult time, you see the best and worst of people, but I see the like-mindedness of all my colleagues and myself, that we are in this not just because it's our job or our duty, but there's that passion for service.
I'm just happy that at the end of the day, whatever work we do, no matter how small or big, it provides that little respite or cheer to our colleagues.
Actually, I was very happy when there's a chance to volunteer for the dormitory. It is in a way to answer to our calling and our responsibility, or rather our obligation to this society as a healthcare worker. As a doctor, I don't know people unless I really talk to them. I get to feel them and I get to heal them. Then I know them better. I would never have known the foreign workers, how they are like, without this opportunity. To know they are sent from us and they need help. And our job is to give help to those people who need it.
When I see patients being discharged, I feel really happy, and that motivates me.
The most memorable times, I guess, is the kindness and appreciation to healthcare workers. we have all the supports, be it from the management as well as from the external parties. They are very appreciative of healthcare workers. Whatever I do actually really make an impact. Things like that, yeah, that really touches me.
Thank you everyone for all the hard work that you have done. I'm sure we can do it.
As the going gets tough, the tough gets going. You are not alone. Let's stay together to overcome this crisis.
I'm proud to say that I belong to this family, and just like any other challenges that we have faced, I believe that this too will also pass on.
This difficult period, I understand we are all giving our best to care for our patients, but I would like to remind ourselves to take a moment to take care of ourselves as well.
I would like to thank everyone for being perseverant during this difficult time. We all can do it.
I would like to encourage all the members of my KKH family, everybody to come out, chip in, and let's do this thing together.
In KKH, we work all together as a family.
Take care of yourself so that you can take care of others.
Together, we can pull this through. So there will be light at the end of this tunnel. Let's do it together. Stay safe. 加油!
You are the front line and last line of defense against COVID-19. Stay safe. Together we can.